You have probably seen dozens of best back pain exercises online. One video says, just stretch this. Another says, just strengthen that. It is confusing, and most people end up trying a few moves randomly, stopping when something hurts, and then deciding, exercise just does not work for my back. What most of those lists miss is the way the spine actually lives in your body. Your back does not only need flexibility or only need strength. A spine that has carried you for 50, 60, or 70 years needs three things working together. Gentle motion to keep the joints from stiffening, stability to keep the small segments from wobbling, and practice using that control in real-life movements like standing, bending, and walking. Large clinical guidelines for low back pain now recommend a mix of approaches for adults, including older adults, general physical activity, specific trunk muscle training, and functional exercises that relate to daily life. Reviews of exercise programs for chronic low back pain show that combinations of mobility, strengthening, and functional training tend to work better than any single magic exercise by itself. In other words, a smart combo beats a scattered collection. My name is Dr. Robert Ellis. After more than 20 years working with older adults, there has been the same pattern again and again. The seniors who do best with back pain are not the ones doing the fanciest routines. They are the ones who have a simple, repeatable sequence that moves their spine, wakes up their deep support muscles, and then asks their body to practice using that support in something practical, like standing up from a chair or taking a stronger step. The system you live in, however, is full of mixed messages. One side tells you, rest your back, avoid pain, do not move too much. The other side throws endless exercise clips at you with no clear plan, as if adding more moves will automatically help. Very little of it is designed specifically for a 60, 70, or 80-year-old who wants to hurt less and stay independent, not train for a marathon. So the real enemy here is not your age or even your spine. It is the scattershot approach to exercise, doing random stretches one day, a strength move another, nothing the next, with no sense of how these pieces are supposed to fit together for your back. This kind of trial and error often leaves older adults more confused, sometimes more sore, and more likely to give up. Underneath the confusion, there is a hidden condition that almost no one names clearly: untrained movement chains. Your spine does not work alone. It is part of a chain. Your hips, your core, your legs, your balance. If that chain is stiff in some places, weak in others, and uncoordinated as a whole, even a good exercise done in isolation may not change how your back feels when you get out of a chair or walk across a parking lot. Many seniors describe this without knowing the terms. They say, the exercises feel okay while I'm on the floor, but when I stand up, I still move like I am 90. What they are noticing is that their exercise world and their real-life world are not connected. The movement chain has not been trained from gentle motion to stability to real-life use. The good news is that this chain can be trained, and it does not have to be complicated. This video will walk through a three-part combo: move, stabilize, apply, using 3 exercises that work especially well for many people over 50 with back pain. A gentle mobility move, a classic stability drill, and a functional strength exercise that ties it all together. This is Dr. Robert Ellis. By the end of this video, You will not just have 3 more exercises. You will have a small, logical sequence you can repeat several times a week, knowing what each part is doing for your spine and your daily life. Now let's break down the combo, from the lowest to the highest impact on how you move through your day. Exercise 1. Gentle pelvic rock or knee to chest. Move. Lowest impact, best starting point. Mechanism. The first exercise prepares the joints and tissues of your lower back and hips with gentle motion. Think of it as oiling the hinges before you load them. Stiff joints and tight tissues complain more when you ask them to hold or carry. A few minutes of guided movement can reduce that stiffness and make the next exercises safer. One simple version is the pelvic rock on your back. Lie on a firm bed or mat with your knees bent and feet flat. As you breathe out, gently flatten your lower back into the surface, tipping your tailbone slightly up. As you breathe in, let your back return to its natural curve, with a small space under your lower spine. You are not forcing big motions. You are rocking a quiet wave through the pelvis and lower back. Another option, if pelvic rock bothers you, is a gentle single knee to chest stretch. From the same starting position, slowly bring one knee toward your chest until you feel a mild stretch, not a sharp pull, and hold it for a few breaths before switching sides. This gently lengthens the lower back and glute muscles, which often tighten up from sitting. Study exercise guidelines and physiotherapy resources for low back pain commonly include pelvic tilts and knee-to-chest movements as basic mobility drills because they are low load and help reduce stiffness without placing high compressive or bending forces on the spine. Programs that combine such gentle mobility, work with strengthening and functional training, show better improvements in pain and function than strengthening alone. Daily life relevance. This first exercise represents the move part of the combo. It prepares your spine for everything that follows: standing, walking, lifting, or even just sitting more upright. By loosening stiffness before you ask the back to stabilize or bear weight, you reduce the risk that the next movement will feel like a sudden shock. For a senior routine, even 1-2 minutes of pelvic rocks or knee to chest can be enough. 10 and 15 slow repetitions paired with easy breathing. Over time, many people notice that their first steps after getting up from the floor or bed feel less stiff when they start with this kind of motion. Exercise 2. Bird dog or supported stability drill. Stabilize, medium impact. Mechanism. The second exercise is the stabilize pillar, waking up the deep core and back muscles that keep the spine steady while the arms and legs move. You can think of these exercises as teaching your spine to be a quiet, steady bridge, while the traffic of your daily motions moves across it. The classic version is the bird dog on hands and knees. From a hands and knees position, with hands under shoulders and knees under hips, gently draw your lower belly in, as if tightening a comfortable belt. Then slowly extend one leg back and the opposite arm forward, just until they are in line with your body, not high in the air. Hold a few seconds while breathing, then return and switch sides. The goal is to keep your spine as still and level as you can. For many seniors, especially those with knee or wrist issues, a supported variation is safer. You can stand facing a countertop, place your hands on it, step back so your body is at an angle, and then slowly lift one leg back a little or slide one hand forward along the counter, while keeping your trunk steady. The same rule applies. The middle of the body stays calm while the limb moves. Study stabilization exercises like bird dog are known to increase activation of the deep trunk muscles while keeping spinal loads within safe limits when performed with good form. Research supports such motor control or core stability exercises as part of multidisciplinary treatment for chronic low back pain, improving function and reducing pain for many patients. Daily life relevance. This stabilized piece of the combo trains exactly what your spine needs during activities like reaching into a cabinet, taking a step off a curb, or carrying groceries. The ability to keep from wobbling or collapsing when the limbs move in different directions. Without this training, everyday motions can feel precarious, especially after 50, when balance and reaction times naturally change. In practice, a senior-friendly goal might be 6 to 8 slow repetitions per side, 3 to 5 second holds, 3 to 4 days a week, at the easiest variation that feels safe. Quality matters more than quantity. It is better to do fewer, well-controlled repetitions than more with shaking and breath holding. Exercise 3, sit to stand or chair squat. Apply highest impact for real-world function. Mechanism. The third exercise is where everything comes together, the apply pillar. Here, you ask your spine, hips, and legs to work together in a real-life movement, getting up from and down to a chair. This is not just a leg exercise, it is a functional back exercise because your spine must stay controlled while your whole body moves vertically. To perform a basic sit to stand, sit toward the front of a sturdy chair with your feet flat and about hip width apart. Lean your chest slightly forward as if you were standing up normally and push through your feet to rise to standing. Use your hands on the armrests or your thighs at first if you need to. Then slowly lower back down with control, avoiding flopping heavily into the chair. If standing fully is too hard at first, you can practice partial stands, lifting your bottom just a few inches off the seat and then sitting back down. Or you can use a higher surface, like a firm bed or a taller chair, to reduce the effort while keeping the movement pattern the same. Study functional strengthening exercises such as sit to stand are strongly associated with better mobility and independence in older adults and are commonly included in exercise programs for seniors with back pain. Building leg strength and coordination in this way helps offload the spine during everyday tasks and is linked to lower risk of disability and falls. Daily life relevance. This apply component is where your combo starts changing your life, not just your exercise session. Standing up from the toilet, getting out of the car, rising from a restaurant chair, these are all sit-to-stands. When you train this movement, you are directly improving the skill you use many times a day. For many people over 50, a realistic starting point is 5 to 8 sit-to-stands, done slowly, once a day or every other day. Over time, as it becomes easier, you can add more repetitions or do a second set, always watching that your back feels supported, not strained. Why the combo matters more than the pieces. Now that you have seen the 3 exercises, here is the key idea. Doing them in sequence, move, then stabilize, then apply, changes how your spine experiences them. If you jump straight into stability or functional strength without any mobility, stiff joints may complain, and you might feel more pain. If you only do mobility, Your spine may feel looser for a little while, but it will not have more support when you stand and walk. If you only do functional moves like sit to stands without preparing the spine or waking up the core, you may end up reinforcing old, compensating patterns. By combining them, you give your back a story it understands. First, we can move a little. Second, we can hold steady while something moves. Third, we can use that control in a real task. That is how your nervous system learns. That is how confidence slowly returns. Over weeks and months, this combo can do more than lower your pain. It can make you feel more willing to walk farther, less afraid of chairs without armrests, and more secure when bending or turning. Those are not just exercise wins. They are independence wins. You are not training for a fitness cover. You are training for your life. It is important to say this clearly. This 3-exercise combo is not a fitness challenge or a test of willpower. You are not doing it to get 6-pack abs or to impress anyone at the gym. You are doing it to make everyday movements less painful and less scary. You do not have to see yourself as someone who works out. You can see yourself as someone who takes 10-15 minutes a few days a week to teach my back and my legs how to work together. For a grandparent, that might mean being able to get down toward the floor a little more easily to play with a child. For a retired worker, it might mean getting through a grocery trip or a church service without feeling destroyed afterward. Your identity is not a bad back. Your identity can be a person with a sensitive back who is learning new ways to move. That may sound small, but in clinic after clinic, that shift from helplessness to gentle action has been one of the most powerful changes seen. A gentle call to try the combo. If this 3-exercise combo made sense to you, if it felt like a simple story your body could understand instead of a random list, consider trying it at your own level. Maybe tonight or tomorrow, start with just exercise 1 and 2. When those feel comfortable, add exercise 3. If something hurts sharply or feels wrong, back off and talk with your doctor or physical therapist about how to adapt it. This is Dr. Robert Ellis. If this video helped you see that back pain exercises do not have to be complicated, they just have to be connected, consider liking the video and subscribing to the channel. It helps more people over 50 find practical, respectful ways to care for their backs without being overwhelmed. You are not too old to teach your spine a new routine. You are not too weak to start with a small combo. You are simply at a moment in life where the right 3 exercises, done in the right order, can quietly help your back feel safer, stronger, and more reliable in the movements that matter most to you.